Hello, this is Dr. Jason Acevedo, here to talk to you a little bit about functional endoscopic sinus surgery, or Fess is the acronym we use for this procedure. And if you're watching this video, excuse me, it's probably because either you or your loved one is in the process of being scheduled for this surgery or has this surgery upcoming, or maybe already has even had this surgery and just have some questions. To give you a brief overview, endoscopic sinus surgery is a very safe, but relatively common procedure that's done for patients that have a condition called chronic sinusitis. And chronic sinusitis is a condition where your sinuses don't drain properly. Therefore, you retain material in your sinuses, which then stays chronically infected. And from then on, you tend to always have sinus infection. And a lot of times patients who come in will tell you they get 4, 5, 6 sinus infections a year, whereas in reality they almost always have a sinus infection that's really never completely resolved. And endoscopic sinus surgery is a great option for patients like that, who've been through antibiotics, who've been through steroids, allergy medications, nasal rinses. All the standard things don't seem to be working. And typically, if you're watching this video, you've probably already had a CAT scan of your sinuses. That's a radiology test that we do to look and see the status of your sinuses and to confirm that that's what you had going on. So once we've made the decision to go forward with endoscopic sinus surgery, it is typically done in the operating room, either at the surgery center or at the hospital. It is something done under general anesthesia so that the patient doesn't feel anything, they don't remember anything, they're completely asleep. And essentially what happens is, what we do with the procedure is once our patient is off to sleep and comfortable, I would go inside the nose with a camera. That would allow me to find the blockages in the sinuses. And then I can open them using a tool called a microdebrider that gently opens the opening to those sinuses and enlarges it. It lets me clean out any chronic infection that's there, any nasal polyps, anything that may be causing that chronic sinusitis. After that, I tend to usually also reduce the turbinates, which are basically a piece of tissue inside your nose that tends to be very enlarged and obstructed when you have chronic sinusitis or even allergies. And by shrinking those turbinates, it tends to help quite a bit with nasal breathing as well. Now, the extent of the surgery is determined a lot by the CAT scan and how it looked and which sinuses were affected. But in general, the surgery is anywhere from 45 minutes up to an hour and a half. Like I mentioned, very safe, very well tolerated, and the vast majority of patients would go home the same day. Now, afterwards, when the surgery is complete, you can probably plan to be in the recovery area for the better part of an hour before you go home. Afterwards, it is very important to start doing sinus rinses or saline rinses. There are several kinds available. One of the more common is the NeilMed sinus rinse that you can find at pretty much any pharmacy or even online. And with that rinse, what you're going to want to do is, starting the day after surgery, is mix up your rinse, which it'll be a pre-measured salt packet, small little bottle that you'll fill with distilled water up to the line, and then use half the bottle to really irrigate and flush your sinuses, both sides, and at least twice a day until your first post-op appointment, which is usually scheduled 1 to 2 weeks after your surgery. Typically after surgery too, you would have a prescription for a narcotic pain medicine, which best case you won't even need it. You're not required to take it. You can always start with ibuprofen, Tylenol, over-the-counter type pain medications. And if they're not relieving the pain, you can always bump it up to the stronger stuff. And if you do end up taking your narcotic pain medicine, you do want to make sure you've got some food in your stomach prior to taking that. It's pretty common to have some bleeding after surgery, not profuse, crazy life-threatening bleeding, but some bloody discharge, blood if you cough or sneeze is pretty common. Pain, like I mentioned, it's possible. It's usually not severe, but you will have some medication to treat that. Other potential complications, which are fortunately very rare, we always talk about injuries to the structures around the sinuses. The biggest two are the base of the skull and the eye socket. Like I said, fortunately, due to the technology we have, the high-resolution CAT scans, the high-definition cameras, these things are very uncommon. But I do always mention the potential for issues with the eye. Typically would be bleeding behind the eye socket. And that's something I would not expect, but something that if you were to see it, if you were to see swelling in the eye, changes in vision, that's something you'd want to call right away and let me know. Same thing with injuries to the base of the skull. Normally you would know that by, say, severe headache, leaking of fluid, say if you were constantly having a kind of a salty drip from the nose. Super uncommon, very unusual, but something I always mention so that if you see it, you would call me and let me know. But overall, very safe, very common procedure, and something that tends to be tremendously helpful. Once patients are healed, they tend to tell you they breathe better through their nose, their smell is better, less postnasal drainage, less runny nose, less cough, less pressure in the face, less headaches. And even a lot of patients will notice a decrease in fatigue. So hopefully that's answered most of the questions you would have. And if you are scheduled for this surgery and have additional questions, please call the office and let me know. Take care.